Hi, this is Deb Peterson. I'm the ADRC Project Director. ADRC stands for Aging and Disability Resource Connections. In South Dakota, nationally, it stands for Aging and Disability Resource Centers. The U.S. Centers for Disease Control and Prevention defines aging in place as the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. All of us want to remain living at home for as long as possible, so our goal is to assist people to continue living at home or to return to their home whenever possible. As we think about what it means to age in place, most of us want to remain living at home and in our community, surrounded by family and friends, the places we like to frequent, the activities that are familiar and give meaning to our lives. According to the U.S. Census Bureau report entitled An Aging World in 2015, in the U.S., people age 65 and older comprise 14.9% of the total population. By 2050, people aged 65 and older are expected to comprise 22% of the total population. The average life expectancy in the U.S. is 78.8 years. The average median life expectancy is 81.2 years for all countries. In Japan, it's 83.4, and in Switzerland, 82.9. Not surprising, what we've heard is that Oglala, Lakota County, from this report, the average median age is 67 years. And in Colorado and Summit County, the average median age is 85 years. So by 2025, elders over age 65 in South Dakota are going to increase by 92,000 to 105,000, and that would be 24% of the state's population. People over age 65 who are disabled will increase by 42,000 to 50,000, and that's over 10% of the population. This map contains 2015 data projections for those counties in South Dakota where the elderly population is expected to double from 2010 to 2035. It reflects the number of people who will be living in around Sioux Falls and Rapid City in the hills. We also will likely see people moving to other larger cities like Aberdeen, Watertown, Brookings, and Yankton. People are moving to the larger areas in the state where there are increased access to health care, in-home services, and things like public transportation. Now, many people move to be closer to children and grandchildren, and sometimes that is within the state. Other times it's with their children and grandchildren outside of the state. There are others who will want to remain in their current homes in the rural areas, but there may not be the kind of services they need. They may not be readily available, and people in those more rural areas will likely be relying more on natural supports of family, friends, and neighbors. The ADRC is the no wrong door where people of all ages, incomes, and disabilities can call to get information on public, private, long-term services and supports. And we provide this through information referral, options planning, and helping them to access those services. This map reflects the 5 ADRC call centers that have assigned 1-800 toll-free telephone numbers, and these are toll-free in and out of state. These numbers, once called, will assist individuals to access those long-term services and supports they need to continue to remain living at home. LTSS has 57 specialists who are located in 24 local offices, which are indicated in the darker blue on the map. Specialists complete intake and referral, assessment, care planning, and ongoing case management. When a contact is made by phone, email, walk-in, the specialist gathers demographic information on why the person's calling. The specialist records the contact in an information referral database, or SAMS INR. It includes the outcome of the contact, referral activities. SAMS is a software application for recording intake information on all contacts made to the ADRC. Specialists, whenever possible, use a warm telephone transfer, keeping the caller on the line and then connecting them directly with the person, the organization, the provider. If you don't know how to do this, please talk to your supervisor about how you can provide this customer with a warm call transfer. Options planning is a free service offering information assistance to plan and make decisions, help people plan for tomorrow on how to meet their long-term care needs through available services, supports, and resources. Now, this can help people make decisions about whether to continue living at home or making a move to an independent retirement community, or moving from a house to a condo or to an apartment, moving to another area of the state. Is there a need to make home modifications to widen doorways for wheelchair access, to add a ramp or other modifications? What about moving the washer and dryer from the basement to the first floor, using assistive devices like grab bars, shower chairs, toilet risers, moving the upstairs bedroom to our first floor, getting some help with housekeeping, vacuuming, remembering to take medications, giving consideration to what assistance might be available from their family, friends, neighbors, or other informal supports. When people are able to make informed decisions, they are likely to be more satisfied with their quality of life because they decide what services they want and how, where they can receive those services and supports. And I often talk about my sister, who is 78 years old, and how for years she walked up and down the stairs to access her bedroom on the second floor, and how she went into the basement down the stairs to access her laundry. Now, I had mentioned to her several times about moving her laundry up to their entry that was in the back of the house, just on top of the basement stairs. I also visited with her about why not moving downstairs and sleeping at night in the bedroom that they used to have down there, which was now a computer room. And it took lots of conversations with her to have her see the benefits of doing so. And so eventually they insulated the entry and they moved their washer and dryer up to that space. She no longer had to go down the stairs basically on her butt, or basically climb the stairs using her hands to get back up. She also put a rope on the stairs going up to the second floor to give her better stabilization when she went up and down the stairs. So now they have moved their bedroom down to the first floor, and I think they're a lot happier and having that easier access. And basically, I consider that I did options planning with her to bring about those changes. And that was all over the phone because she lives in Montana. So options planning goes beyond providing information. It involves a specialist acting as a facilitator who gathers information from the person to understand their situation, offers information and decision support to help determine the services that can best meet their needs. It includes giving consideration to the person's feelings about their current circumstances and finding out what is important to the person. Learning what the person knows and what they do not know, then providing effective guidance to match the needs, preferences, and values with available services and supports. We assist people to remain living at home and return home by providing them with the services and supports they need, whether that's through one of our programs or services from another public or private entity. The benefits of options planning are connecting individuals to all of those public and private services, assisting them to make decisions to maximize their independence, helping them to sort through information that is available but can be complex and confusing. The ADRC has an intake process when the call goes beyond providing information referral, information only, or options planning. We assist the person asking about 40 questions to help determine their level of service need. The South Dakota Choices helps us to do that. There are algorithms in the South Dakota Choices that are assigned to the questions to help provide the level of service need, ranging from level 1 to 5. This then helps the specialist to determine whether the person can continue to be assisted over the phone, or whether a home visit may be needed, and then whether an assessment may be needed to be completed during that home visit. And these are the levels that we obtain as the outcome after completing the intake screen. So when the results of the South Dakota choices are level 1, the need is information only or a basic service, like only needing an assisted device or emergency response, meals, nutritional supplements, medical equipment, or medical supplies. When there's a request for a basic service, we immediately respond by connecting the person with that service. We don't need to visit the home or complete an assessment. We respond to the request to meet that person's need over the phone. If it's a level 2, we may then decide we need to visit the home to determine the kind of assistance a person needs. And this is usually assistance with completing household tasks. If homemaker is the only service needed, we complete a basic task list of household tasks the person needs. When it's a level 3, 4, and 5, we visit the home with the intent that we're going to need to complete an in-home assessment with the person to determine their need for personal care or nursing, in addition to possibly homemaker services. The outcome of the intake call may also only result in providing information referral, and options planning. The South Dakota Choices has a question the specialist answers on whether there's a concern regarding the responses given to the questions on the screen. These options are no concern, underestimated needs, overestimated needs. If the specialist believes the person underestimated their needs and the screen results are 1, the specialist can override the screen and make a home visit to determine whether there may be additional need for services such as homemaker, personal care, and nursing. The specialist may also, based on the visit, complete an assessment. Other times, the specialist may believe the person overestimated their need. They may have a level 1 or may have a level 2. And if you ever have a question about that, please feel free to always go visit the individual to better assess their need for services. This flowchart shows the no wrong door, and that we may only provide information referral, and we may only provide options planning to that person, and the call may end at that point. Or we may go into then completing the choices screen. We in fact do complete the choices screen whenever there's a request for a service. But at the end of that screen, we may get a level 1 or 2 or a 3 to 5, or we may just provide options planning and information referral. And this is all based on the information that is obtained during the screen. This flowchart again explains the intake process. When there is a request for information, the specialist enters the call into SAM's INR and provides information, offers options planning as appropriate, and so this may end the call. When a person is unsure of their need or the service is available, the call will move into completing the choices screen to help determine the person's level of service need. So this may include a home visit. When the person needs personal care and nursing, the assessment is completed during a home visit within 7 days of the intake call. Through the assessment, the ASA specialist gathers information to determine a person's strengths and needs. And this is a community health assessment. This is through NRI, the University of Michigan. It is standardized. The child helps determine a person's service needs, and the resultant assessment outcomes are used in developing a care plan that is person-centered with individualized goals and strategies. The care plan is developed with the person based on the person's needs and includes others whom the person wants to participate in that care planning process. The care plan includes assistance provided through formal or paid services, natural supports, non-paid from family and friends, and community resources, and maybe other services and organizations. It assists a person to make informed decisions about where and how he/she will receive services and supports. Ongoing case management is provided consisting of regular telephone calls and home visits with the individual to determine if they have questions, concerns, or need additional services and supports, or if they no longer need or want a service. This flowchart reflects the ongoing case management that's completed with our consumers. Individuals with more complex needs due to personal care or nursing will receive increased follow-up from a 2-week phone call to a quarterly contact, a 6-month visit, and an annual visit. By contrast, a person who's assisted over the phone to get an emergency response system or assisted advice, continence supplies, one of those basic services, may only need contact over the phone at 2 weeks, 6 weeks, and annually. And then at 6 months, for those consumers receiving homemaker services, personal care, and nursing, we complete a satisfaction survey called the Quality of Life. Now you can see at each one of these, whether it's a basic service, a homemaker service, personal care, or nursing, we will complete a 2-week follow-up call with every consumer. And that's to ascertain that they have received the device, the equipment, the supplies, or they've been contacted by the homemaker or by the agency providing the personal care and or nursing services. The Quality of Life Survey, again, is developed by NRI, Self-Report Home Care Community Living Quality of Life Survey. Questions measure an individual's satisfaction on areas including safety and security, comfort, environment, respect, and worker responsiveness. The survey is completed over the phone with consumers receiving homemaker services and during a home visit with consumers receiving personal care and nursing services, and this quality of life review is completed every year with the consumer. On our quality of life survey responses between October 14 to March of 15, we assessed that 89% said they feel safe when they are alone. 89% said, I need help right away. If I need help right away, I can get it. 92%, I get the services I need. Again, 92% reported I am treated with respect by the people involved in my support and care. And 89% reported that the care and support I get help me live my life the way I want. Individuals age 60 and older and individuals age 18 and older with a qualified disability are eligible who have an assessed need for the service and meet specific service eligibility criteria. If single, they have resources at or below $40,000, and that includes checking, savings, stocks, bonds, CDs, IRA, annuity. If married, they have resources at or below $45,000. Now, the various LTSS programs that you're going to hear about are listed here, and those range from assisted devices, emergency response, meals, nutritional supplements, medical supplies like incontinence supplies, other medical supplies, equipment, homemaker personal care and nursing, telehealth. And we also have our caregiver program that you're going to hear about, our SHINE program, our APS, legal services that are available, the Ombudsman program, adult day, and transportation. We'll also be hearing about the HCBS waiver, and this serves individuals age 65 and older and individuals age 18 and older have a qualifying disability. The purpose of the waiver is to provide home and community-based services to individuals to enable them to remain living at home or in the least restrictive environment available. To be eligible for waiver services, the individual must meet nursing facility level of care, requiring daily nursing, assistance with activities of daily living, or weekly therapy. Level of care determinations are completed by a medical review team, which consists of a South Dakota licensed registered nurse and a LTSS specialist. Then the Division of Economic Assistance within the Department of Social Services makes financial and other eligibility determinations. The home and community-based services that are available and that you will be hearing from during the new employee training are listed on this slide. The waiver is approved by Centers for Medicare and Medicaid Services and allows us to use state and federal funding to provide home and community-based services to individuals who are at risk of long-term care facility placement. This list is available in these services to individuals based on an assessed need for the service. And the assessment that is used is the NRI Community Health Assessment, or the CHA. And some of these services are only available through the waiver. They're just specific to the waiver as a waiver service. And those are asterisked here on the slide. They're chore, adult companion, assistive technology, and environmental accessibility adaptations. Assisted living is also only a waiver service. All waiver services that are also covered in the Medicare state plan, those include homemaker, personal care, and in-home nursing, and must be exhausted first under the state plan before waiver services can be utilized. You will hear more about that through the HCBS waiver service presentation. Environmental accessibility adaptations are those physical adaptations to the private residence of the individual required by the care plan that are necessary to ensure the health, welfare, and safety, or enable the individual to function with greater independence within the home. Examples of these are the ramps, widening doorways, modifications to bathrooms, installation of specific electric or plumbing systems to accommodate medical equipment and supplies that are necessary for the welfare of the individual. Adult companion services are when the person needs a companion to assist and support them, such as in shopping, pharmacy pickups, non-medical appointments, and activities that help individuals participate in the community. Companions may transport and accompany individuals to events or socialization activities that meet their personal goal that's identified in their care plan. I also wanted to visit about the ADRC resource directory, and that's available at the website that's listed. And this is available to anyone who needs information on services and supports. The directory lists various providers, agencies, and organizations in the state. It includes in-home providers, independent living centers, mental health centers, domestic abuse, hospice, adult day, assisted living, nursing facilities, and much more. A person can click on organizations specifically. They can type in what their need may be, such as meals, and then they can enter their zip code and the miles within their area, and they will get a list of meal providers within their area or zip code of the state. They can do this for other services that they need. There's also an Assess My Needs, where the individual can click on certain areas that are listed and their zip code and get the same information. We also have a learning library. The individual can go in and click on a topic area, which then links them to specific information on that topic and links them to federal and state information on the topic. This concludes the presentation on the ADRC. I want to thank you and welcome you to Long-Term Services and Supports.